Yes, and today we will talk about mental disorders. It will be a short general overview of some of mental disorders. And the first disorder that to mention talking about mental disorders is schizophrenia, as one of the most severe and having dramatic consequences. Schizophrenia and the related psychotic illness belong to a group of disorders called the functional psychosis. Functional in this context means a disorder of brain function with no corresponding structural abnormality. Although by itself schizophrenia causes significant damage of the brain. And etiology of schizophrenia is currently still unknown, and there is no definite diagnostic test available. For this reason, diagnosis is made clinically using operationally defined criteria, characteristic symptoms and signs. Absence of primary organic disorder and interview and observation. And what are the main symptoms of schizophrenia? The main features in schizophrenia and the related psychotic illness is the presence of psychotic symptoms, hallucinations, and delusions. Delusions means when a person is losing the contact with the real world and lives in his inventory illusory world. Hallucinations, and we have talked about that in previous meeting, that there are different types of hallucinations, and it depends on the severity of the schizophrenia. Mainly there are prevailing auditory hallucinations. Although apart that may exist all other hallucinations connected to all senses, to all five senses, and even the sixth sense, the psychological sixth sense, the intuition might be involved. Therefore, there are tactile hallucinations, olfactory hallucinations, taste hallucinations, and visual hallucinations. And all of them all those hallucinations have very dramatic context connected to unpleasant experiences. Auditory hallucinations might be of a threatening, scaring character, and it depends whether they are pseudo or real hallucinations, whether the person perceives it as it is in his head, only in his head, or it is all the other type of hallucinations that there is an outside external environmental factors trigger that might be the sound of a wind, sound of a train, that may cause the hallucinatory perception. Visual hallucinations that might be connected to death, or if the person's relative or family member a friend is deceased, he or she may see them in their visual hallucinations. Olfactory hallucinations are mainly connected to unpleasant smell, and about tactile hallucinations, they are irritable hallucinations, even might be connected to pseudo-allergy. When an individual experiences hallucinations or becomes paranoid that people are talking about them, for example, it does not mean they necessarily have a severe and enduring mental disorder, and that's very important to consider, because when hallucinatory symptoms persist, there is no rush to jump to the conclusions and prescribe some medications that need only for the schizophrenia treatment. Hallucinations could be experiencing a reaction to drugs prescribed or recreationally taken, by experiencing severe anxiety, be acutely confused as a result of a chronic stress, or have early signs of dementia. Schizophrenia usually begins in late adolescence or early adulthood. Untreated, it turns a chronic, deteriorating course. In addition to personal tragedy, schizophrenia creates a burden to their family members. The symptoms of schizophrenia are divided into symptoms. They are positive and negative symptoms. Positive symptoms: an excess or a distortion of normal functioning, delusions, thought interference, or passivity delusions. Hallucinations, usually auditory hallucinations, commenting on the subject or referring to them in the third person. For example, he looks like a fool, he is a loser, he is a stupid, and etc. Formal thought disorders, a loss of the normal flow of thinking, usually shown in the subject's speech or writing. As a result, that hallucinations, as might be expected, interferes with the normal thought flow. Therefore, it is revealed in a speech and writing. Sometimes a patient talks logically, normally, but suddenly in one sentence there are total derogation from the normal sequence of the thought. Negative symptoms: a decrease or loss of functioning, impairment or loss of motivation, spontaneous behavior, loss of awareness of socially appropriate behavior and social withdrawal, flattening of mood, poverty of thought and speech. Flattening of mood, and here might be one differentiated diagnosis: bipolar disorder, because as in bipolar disorder, there are flattening of mood, jumping from depression to the anxiety. And there are some famous people known with schizophrenia, and one example is a famous film, A Beautiful Mind, where the main character of the film and the book by Sylvia Nasar, that a gifted mathematician, Nobel Prize winner John Nash might be told that a severe schizophrenia, although succeeded in a scientific field. And the characteristics of symptoms. Once again, there are delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, affective flattening, elogia or evolution, and social and occupational dysfunction, because all these symptoms interfere with social functioning and occupation. For example, if delusions are bizarre or hallucinations consist of a voice keeping up a running commentary on the person's behavior or thought, or two or more voices conversing with each other. That's a severe example of schizophrenia, because schizophrenia have their gradation according to a severity. There are mild forms, moderate and severe forms. And that depends on the severity and plot of the hallucinations and delusions. And about categories of schizophrenia. There are paranoid schizophrenia, hebephrenic, catatonic schizophrenia, undifferentiated schizophrenia, post-schizophrenic depression, and simple schizophrenia. And let's talk briefly about them. Paranoid schizophrenia is a paranoid character type of a person. There are persisting delusions and hallucinations. Paranoid type of a person means that a person doubts everyone. There might be friends, people, colleagues in a workplace, even close family members. He or she perceives that everyone is his enemy. And about hebephrenic schizophrenia, disorganized type, disorganized speech and behavior often inappropriate. Catatonic schizophrenia main feature is psychomotor disturbance. Undifferentiated means all, but depressive often blame themselves for their disease. They perceive that it is their fault, they can't manage their emotions, their feelings, and are burden for themselves and others too. Because of that, they may develop severe depression. And simple schizophrenia, the other type of schizophrenia, there are no delusions or hallucinations, although persists a defect state, gradually arouses without an acute episodes, and usually has a chronic character. Patients with simple schizophrenia might be more integrated socially and have higher social function. And about historical views of schizophrenia. In 1896, Emil Kraepelin first time described the two major forms of insanity on the basis of different symptoms, course, and outcome. The first was manic depressive insanity, had a replacing and remitting course with full recovery after each episode. The second group together catatonia, hebephrenia, and the paranoid psychosis under the term dementia praxis, which have a progressive deteriorating course where any improvements